Hi, I'm Dr. H.B. Chandalia from Mumbai, Director of Endocrinology, Diabetes and Metabolism at Jaslok Hospital and Research Centre. I'm speaking from the International Diabetes Summit in Pune, organized by Chelaram Diabetes Institute. The topic I discussed here is a very interesting one. It relates to a group of new compounds, that is the SGLP-2 inhibitors. Most important aspect of these compounds is that this class of compounds, and in particular what I'll discuss is empagliflozin, offer unique protection against the cardiovascular disease. So besides GLP-1RA, this is a group of compounds which offer cardiovascular protection. At the present time, we are using 3 molecules in this category. One is empagliflozin, canagliflozin, and dapagliflozin. There are some subtle differences between these 3. For example, the benefits in cardiovascular mortality and all-cause mortality has been shown only with empagliflozin. On the other hand, the protection against renal disease and the protection against heart failure has been found to be common to all these 3 molecules, and it occurs to the extent of 30 to 40%, so that it is highly significant. So there are certain similarity between these molecules, but empagliflozin stands out very, very prominently because it was the first one with the publication of EMPA-REG study showed very clearly that the benefits of 3-point MACE, that is measure adverse cardiovascular events, which is a combination of myocardial infarction, stroke, or the death due to cardiovascular disease. So it showed clear benefit there, and most importantly, it showed benefits in cardiovascular and all-cause mortality. These compounds have now been clearly listed, and there is a label on these compounds by US FDA. For example, empagliflozin has a label that if a type 2 diabetic is having grave cardiovascular risk factors or already has had a cardiovascular event, these drugs should be seriously considered in each of these patients. In fact, not prescribing these is considered a deficiency in prescription. Very important to know that there is a possibility that these compounds also help patients with somewhat long duration of diabetes, like more than 10 years, and with only cardiovascular risk factors or occult cardiovascular disease, so that we are trying to extend use of these compounds further to not only people who have already suffered a cardiovascular event or who have grave uncontrollable cardiovascular risk factors, but even extending it to the earlier phases of type 2 diabetes, where the protection also can be good. These studies have shown, for example, empagliflozin has shown that not only does it improve the cardiovascular mortality and all-cause mortality, but it is not a function of heart failure. So it does so even in patients with or without history of heart failure. And another important thing to know is that it also shows even in people who had the cardiovascular events and those who did not have an event but only had grave risk factors. So the compound is, this molecule is now going to find far wider use in type 2 diabetes. The other 2 gliflozin use have also shown benefits, as I said earlier, in the renal protection and protection against hospitalization for heart failure. So overall, they will find very wide use in type 2 diabetes.